Hello, my name's Jane. I'm from Portishead. I lived there for 8 years. Cleveland before that, very local. And I've been coming to Evolve for about 4 years now, 4 or 5 years. And I've always found it very friendly, helpful and professional. I used to smoke a lot of years ago, very conscious of my the gaps in my teeth. I was a bit wary to smile. I'd always smile but not show my teeth until I came here and started going through the process of having my teeth restored to me. So I've only had these well, they're not new teeth, but I've had composite bonding, which I've only had for about 3 or 4 weeks. So originally I was a little bit self-conscious because they're a lot bigger than my other teeth. But over the last week or so, I've kind of got used to them and I love them now.
With Yasmin, it's really nice. Yeah, she's always putting the patient's interests first. She just works really hard.
My name is Yasmin. I'm one of the dentists that works here at Evolve. Oh, I went a really long-winded way. I was like the eternal student at university for 8 years. So I did psychology first, and then I did kind of neuroscience as part of that, and then went into dentistry afterwards. And I always remember kind of being at university, people saying like, why did you do psychology and dentistry? Thinking it was a massive jump. But actually it's all about people, making people feel comfortable in unusual situations. And I find I use it genuinely every day. My wonderful patient, Jane, for a long time now has had really worn front teeth. And her daughter's getting married this year in July, I believe. And she wanted something to kind of make her just look a little bit brighter and happier in the photos and whatnot. And we originally had planned crowns for the front 4 teeth. But then as I'm currently on this year-long course, I learned that there was a different technique that was probably a little bit more minimally invasive, a little bit more financially viable for right now, but also was a really good option for later on about kind of maintaining as much tooth tissue as possible, preventing complications, things like that. And rather than have an ego about it, I just had a really honest conversation with the patient saying, I learned something new, would you mind if we kind of went down this direction? So instead of crowns, we're essentially doing composite build-ups using a stent technique, allowing the back teeth to kind of dial into place. And then with the view that in the future, once the space has kind of been maintained and created, that we can then switch to porcelain and maintain as much of her natural tooth as possible, minimizing the risk for things like root canals, sensitivity, complications later on. I don't want things to look great now, and then in 5 years, she needs a load of root canals.
Yasmin has been part of our team for almost 2 years now. I met her through the BACD and immediately was impressed by her attitude. As I said, we always want to get people to join the team based on attitude rather than skill. So she joined us just having finished her foundation year. And so she at that time was quite inexperienced, and her role in the practice, my role with her, was to sort of mentor her and support her through her first couple of years of private dentistry. And I have to say that she is absolutely fantastic with the patients. She is so driven to improve her clinical skills, and the type of dentistry that she's doing now is extraordinary for somebody of her experience. And I have no doubt that she is going to go very far in dentistry.
I like the range of it. So I'm a general restorative dentist, so I do things from fillings and dentures. I do a lot of kind of cosmetic work, so composite bonding, veneers, a bit of Invisalign. Predominantly at the practice, I do the majority of the root canal. So I find that quite interesting. It's a little bit fiddly. It's kind of like when you're changing, you're getting rid of knots in a jewelry, in a necklace. So when you finally get it, it's so satisfying, and actually managing to convince someone that a root canal is actually not that bad kind of feels like you've won them over a little bit. So that's, yeah, I quite like that as well.
She's a perfectionist, very serious of when it comes to what she has to do. And she's so clear with patients and explain everything thorough to them, and it's lovely working with her.
So she planned it really well. She didn't go down the most expensive route like some dentists would. She done the best plan for me and for my teeth. So to be fair, she was amazing.